Hello from Bali. This is the podcast Pigeon of Peace where we do discuss awesome skills of troubleshooters. Watch, listen, and check the description below for the details. Let's talk about surgery and let's start with the definition.
When someone was wounded on the battlefield, if someone would break a bone, we'll need help of paramedics, and one of them should be surgeonist. This person would make some cuts with blade, will collect the bone, will make some operations to put in order internals of the body.
And when we speak about surgery itself, what kind of, I would say maybe situation, not only maybe the battlefield, but, maybe some, something that could happen on a day-to-day basis. What kind of levels of preparations might be needed and what might be the possible situations that, like we could encounter in our daily life?
Maybe some people will wonder why we talk about this skill in the School of Troubleshooters podcasts. But I was working as a bodyguard for 1.5 years, and I was forced to give to pass some exam. One of them was on karate, jiu-jitsu, aikido, physical training, law, and also it was a surgery, field surgery. And I was forced to make some, I don't know how to say, bandage, this
Bandages.
bandages. I was making bandages, and also I don't know how to say, when your leg or arm is broken, you should put some special stick and swap it around. How it's called in
Just a
Russian?
fixer.
It's fixer. Okay, in Russian it would be like shina. Yes.
Fixer is still better.
Fixer. Okay. Again, then. In my life, several times I was using my skills of surgery, and sometimes it would be quite interesting because my wife, she is orthodontist and she is certified doctor, but she never liked to make cuts and to make stitches. So sometimes maybe you will be in the mountains, sometimes you will be in expedition. For example, I have been to Fahrenheit. Polar Soul. It's okay to say Polar Soul? Полярная экспедиция.
Polar Soul or polar expeditions or just
Polar
a pole.
expeditions. Pole. Also, I have been to all mountains of the ex-Soviet Union territory, and I have been on all mountains higher than 8,000 meters. So sometimes it's quite needed to make some improvement of the body. What should you know? First, you should know anatomy. And I have spent 1.5 years to learn anatomy. And it was not so hard for me because my first wife, she was eager to be a surgeonist for children. So I was using her copybooks, and it was quite easy. Second, you should know about joints and venoms and blood system, and you should know a lot of medicine. And this is quite serious topic, and in this I swim quite shallow. I know maybe like 20 or 30 medicine, but sometimes I give advice even our surgeons in the dentistry.
And there is also this thing called like a first responder certification, etc. So I do believe those people more or less like obliged at least to identify themselves, like if there is any emergency situation, they might be summoned in order to provide the help. But if you certified as a surgeon, and let's say, like it could be like a doctor, or maybe I would call it just like a semi-doctor, would you still be obliged, like if there is any situation, to actually conduct the necessary help, or there might be situations when you actually should refrain to like even touch the body?
It's quite a good question. To be honest, for example, in China, if someone would hit the person with a car, he will make it twice or even triple to be sure that this person dead. Because for that person is much easier punishment than to support the life of the injured body for several years. But I will give you an example. Several years ago, my wife, she was working in another company, in medical company, and one stage below, it was a training. The name of this training was Sparta, and they were making some hooks, and they beat each other and made they push-ups and burpees and so on. And suddenly she makes me a call, and she was asking, what should I do? Because I was summoned as a doctor because I wear, I don't know how to say, white jacket, белый халат.
White jacket.
white jacket, and so everyone thinks that I'm a doctor. But to be honest, dentistry, this is not a common doctors. They have separate education, and they have lessons all together with other doctors just for 2 years, and then for 5 plus 2 years they have learned themselves separately. And she was asking, what should I do? And I told her, refrain from the help. You are not a doctor, and if this person will die, you will be punished. Suddenly, I got a call from policeman, and he was saying, "Come on, you are a chief doctor maybe, and you say you told to your subordinate not to help to this person, but this person who died." And I told to this policeman, "Sorry, man, my wife." She is a dentist, but she is not a doctor, and she is not obliged, and she is not well qualified to make help. Sadly, but this person died, and it was some inquiry from police, and I was going as a lawyer for my wife, and after several questions, they say, yes, come on, it's very sad that this person is died, but your behavior was quite correct, so no obligation, we will put nothing, no charges against you, something like this. So yes, if you're not sure that you could help, please refrain from the medical aids.
Well, it's actually interesting that you touched this topic, and I do remember it's one of the skills you also told us that each surgeon, they would have their own little, or maybe not so little, graveyard. And you also touched on the legal aspect. So let's say when we go in under the knife, I just would call it like this, of the surgeon, should we be thinking like whether this person, like obviously, like they can do some wrong cause, they can maybe, like recommend certain wrong treatments, but will they be responsible for this or not? And if we think about it, at certain point of time, they may not, because, like there might be certain, I would say, dependencies on the surgeon. Like it's so few of them and it's so many people, even if it's like sounds cynical. So what should be happening in the head of the surgeon when they're actually trying to fix the situation, and how they should feel about the pressure when, there is like a family standing right behind the door and you have to, like maybe tell them some news and maybe they not be so cool.
I was working with surgeons and also from people, I don't know how to say, suit atelier. It's okay to say costume atelier.
Yeah, suit atelier.
Suit atelier for a very long time because I was having a lot of friends who was wounded by bullets, by knife during our special ops. So when I was waiting for my colleagues, for my comrades, how to say comrades?
Comrades are good.
Comrades. Yes, it was in Angola, it was in other countries I couldn't name. And sometime I was talking with surgeons, but after the operation. First, they never give promises because everything could happen. Second, usually when you work with military ones, they are well qualified and they do a lot of operations. For example, we have anesthesiologist. It's okay, anesthesiologist.
Yeah, that's correct one.
In our dentistry, and he is flying twice a year for 3 months on the line. I know it's okay to say in Russian language, line, it's mean like border of the war zone.
Like a front line, yes.
Front line, yes, correct, thank you. Front line, and he doing for 90 days at least 400 flights, because she would go with helicopter to special place, to special position where all people would be already collected, and he will pick up from 6 to 9 people. He will give them, I don't know how to say, kapelnitsa, droperies.
Yeah, probably something like a drop machine or like a drop mechanism.
Yes, thank you. So he would use droperies, and then he would take this guys to the hospital. Then he would make it for several times per day. If you will be in civil hospital, it would be almost the same. You have 2 choices. First, you will go unconscious. It's okay to say unconscious?
Yeah, or loss of conscious.
Yes, thank you. And you have no choice. But if you have relatives, they could ask and transfer you, if it is possible, by your wound, by the time schedule, to another hospital, to most qualified. For example, I was doing, I don't know, like surgery for myself, like every 3 years. It's about legs, it's about joints, it's about shoulders, it's about nose, it's about I don't know how to say, but something in the mouth. And each time I ask my colleague where the best place to go. For example, all my surgeries was done not in our dentistry, because my wife says that because I am a chief or director, maybe surgeon would hesitate and maybe they would afraid. So better to go somewhere else. And this is the reason why surgeon sometimes ask their colleagues to make operation on relatives.
Well, this is actually quite interesting thing. And if we speak about, I would call it like a competences of the surgeon, what might be the main things? And it's not only, I would say, like a soft skills, obviously hard skills also included. So what are like a top things they need to be master of?
Maxim, it's a very good question. On the skill of competition of competences, I never give a speech about this, but usually we know like 400 competences, and we use in School of Troubleshooters just 21, and in Bureau Bragинский we use like 24, but some of them could be used, for example, for flight attendants, for surgeons and some other people who work with fires, with gas, with nature and so on. And one of them is, you will laugh, maybe for a moment, it's a black humor, because sometimes it's very hard to make operations, and even in our dentistry, sometimes it's a lot of blood is going from the wound. It depends from different situations. Sometimes person could be drunk, or maybe after some narcotics, or after some injury, after fight on the street. So sometimes we deal with, I know how to say, порванная щека, broken cheeks.
Ripped cheek.
Ripped cheek. Sometimes it would be broken nose. Sometimes it would be teared off ear. It's okay to say teared off?
Teared off.
Yes, and our surgeon would make all the preparation. By the way, for example, they could make very unusual things. They could put, for example, it was a case, it was a man, he was fighting with another man about woman, and one man откусил, bite off his nose. And he came to our dentistry and he was asking, is it possible to do something? And our surgeon makes some small cut on the leg, on the hip zone, put the piece of the nose on this place, and it was growing for several weeks, and then it was cutted and put on the place. And yes, it is on some angles could be seamed, but it's quite good at job. And another surgeon, he was working not in our clinic, but I was working for several times for him. He specialized on the ears, and also it was the same. Person was tear off his ear by wire on the skate zone or glide zone. How to say?
Glide, probably.
Glide zone, yes. And he came with frozen ear, and he was asking, is it possible to take it back? And yes, he does it, and it was very strange to see.
It's actually quite interesting because what you're saying is more, I would say, relevant to like engineering. If you know like how the body works, like what kind of parts could be connected together, then you can make a proper decision. It also reminds me one of the skills that I'm currently attending is like a programs. If you know how exactly things works, you maybe just to find a good workaround. And speaking about the tools, obviously, like it's all about, like the mastery of the person, but at certain point of time, there might be, like high precision operations, or maybe high risk operations, or maybe there should be special conditions needed in order to proceed with all of the manipulations that surgeon needs to perform. So what might be, like the best skill in order to operate these things, and what is the like a minimum tool set for someone to conduct all of these things?
Maxim, it would be two parts of the answer, and some of them would be not so polite as to be expected. First, sometimes surgeons, they work so hard that they come at home and they drink, for example, whole bottle of vodka. And it was several times when we summoned the surgeon, and he was saying, okay, I will come, but is it okay? I am drunk a bit. And it was twice when my wife says, yes, you should come because we have very special patient and we couldn't refuse him. And yes, it was very strange. A person would come, he has smell of vodka, smell of cigarettes. Then he was sitting, he was preparing, I don't know how to say, cocktail maybe with some ingredients. Then he was drinking and it was looking as to be sober, but it wasn't. And then he was going to make surgery. Second, you could understand how qualified is doctor after the operation if there are any blood spots on the jacket. This means that or operations was very hard or something with qualification. Usually, surgeons do not change jacket if they do, for example, like 2 operations, one after another, like 2 hours and 30 minutes break and 2 hours. But if they do, for example, 4 or more hours operation, they will change t-shirts under the jacket and jacket by itself. Third, they use special lamps without shadows, so they give very special light because surgeons work with assistants, and so for heads would be above the wound and it would be no shadows to look attentively. Then sometime, for example, if we work like in nose, in eye, in some other very hidden places, they use so-called, I know how to say, interior camera. It's okay to say interior camera or endoscopic
Interior, yeah.
camera. Interior camera.
Endoscopic also might be good.
Endoscopic. So they use some special fiber tool to put it somewhere to look how it looks, and then they do operations with special tools through the small holes. For example, sometime it could be done on the heart from the leg. So these tools would go in the body for more than 1 meter, and it's very strange to see. And the same, sometimes they make operations through the eye, but it's not so often through the nose, and even, I know how to say politely, even through the dick.
Well, this is quite interesting, and I don't know how I would feel if there would be one surgeon approaching to me to do the operation and he already would have a blood on his hands or like on his jacket. Then my last question will be how knowing about surgery could help to make this world a better place.
Maxim, when I was going to Kyiv Polytechnical Institute, it was very close to the medical institute, and sometime we were visiting their canteen and we were looking as they make cutting with just usual cutlery by knife, but sausages. They were trying to make cut and they were sewing to make the stitch. So even they were using sausages, and even they were making the jokes. For example, when they have a short course of gynecology, they were saying, their prof will be saying, if you have no girlfriend, you have no chance to learn this theme. But I was several times on the operations, on the eye, in the nose, in some, I don't know how to say, polished muscles.
Area. Yeah, like just an inner area.
Inner areas and so on. And for me, most impressive operation on the eye. I was asked by my friend, do you want to make operation on the eye? I was saying, come on, I have no intention to do this. And suddenly he says, in the human body, everything is not so precise as in your computers. And if you could be precise with your algorithms and data, you could be a good surgeon. And I was doing operation and he was helping me. And I was so afraid, but everything was going well, but I didn't want to make it again. And several times I was asked, I know how to say, zashить, to sew it up.
Sew it up or get some stitches.
To get some stitch after the operations. And this I like a lot because I was needed to make this practice. But it's very strange. I do not afraid blood of the other people, but I afraid blood of myself. And the highest quality of the surgeon is to make operation on himself. There is even associations of the doctors who made appendix out of their body by themselves.
Well, this is quite interesting, and we review the skill of the surgery and how it could be helpful to you. Stay in peace.